let's take a look at the physiology behind post-operative digestive functioning. Believe it or not, your body actually begins to digest the food that you eat right in the mouth. As you are eating or drinking, these substances are mixing with your salivary juices. Now, there are enzymes found here that begin the chemical breakdown process that will later make it possible for your body to actually absorb the nutrients that you are consuming and transform it into energy that you can use. Your teeth also aid in the mouth's digestion activities as they contribute to mechanical digestion. This means that you are further breaking apart the food with the physical act of chewing. And this is a really critical step in preparing the food for digestion, particularly when you have a bariatric procedure. Once the chewing and chemical breakdown of the food is complete in the mouth, the rest of the digestion process is automatic. It is important that those who have had bariatric surgery take advantage of the fact that they have some control during the physical breakdown portion of digestion, or chewing, as chunks that are too big once reaching the esophagus and stomach can cause issues in the surgically revised smaller stomach. With your newly designed stomach, there are several far-reaching impacts it will have. For starters, the stomach will obviously hold less food and liquid. In comparison to a normal stomach that can hold 6 cups or around 3 pounds of food, a sleeve stomach can only hold at max 10 to 15 ounces of food, keeping in mind that the post-gastric sleeve is neither flexible nor distensible. This is one of the reasons the gastric sleeve is so effective in aiding in weight loss. With gastric bypass, the ability for the intestines to absorb nutrients is also compromised. Because the duodenum is responsible for a lot of vitamin and mineral absorption, the gastric bypass procedure can result in deficiencies. The most common ones are B12, folate, zinc, iron, copper, calcium, and vitamin D. The nuances involved with a newly constructed digestive system make following a carefully controlled and monitored diet very important. You're probably well aware that a bariatric lifestyle includes consuming a diet low in fat and high in protein. Following surgery, during the 1 year and beyond phase, your protein intake should be right around 70 grams per day as a minimum. More detailed guidelines can be seen here that include diets for the 2 weeks post-op, 2 months post-op, and 6-month post-op phases. The great thing about this Zoodle casserole is that it is very modest in calories, is packed with protein, and has only 3 grams of fat per serving. With substituting Zoodles for traditional pasta, this meal sits at only 14 grams of carbohydrates and 229 calories per 1/4 of the dish.